our special event today is bloodborne pathogens training. And to provide that, we have the illustrious Mike Stagg to give us the information on bloodborne pathogens. That's kind of a gross subject, though, isn't it, Mike?
Yeah, I mean, it can be. It can be gross, especially if we're not prepared for it and prepared to take the precautions that we need to protect ourselves. But like Jason said, this is one of our topics this month that is one of those OSHA required things that we have to go through if you have employees or if you yourself could be potentially exposed to a bloodborne pathogen. So let's dive right in and get into it.
Mike,
What we'll
not
cover.
seeing your screen.
Oh, you're not seeing my screen.
Not seeing your screen.
I've got the border around like it should be. Let me share again.
There we go.
We're good now?
We got it.
Excellent. All right, so what we're going to cover today, we're going to talk about the hazards. Why it's important, why bloodborne pathogens, and why we have to protect ourselves, how we can prevent it, how we can prevent an exposure to ourselves, what we can do, the different controls that we can employ, and then if we've been exposed, what do we do? If we've got somebody's blood on us, what do we do? Okay. So we have had exposure cases here at the Trust, and I wanted to share just a couple of those with you. You'll notice some commonalities here, though. While stopping 2 inmates from fighting, a deputy was exposed to the inmate's blood, and the blood got on both the hands, the arms, and the uniform of the officer. An employee was helping to pass out dinner trays to an inmate, and the inmate threw that dinner tray back at the officer and that had urine mixed with feces into the employee's face. Okay. Next one, a firefighter was performing CPR on somebody. And while they're performing CPR on somebody, they inserted an airway to help keep this person's airway open while they were giving resuscitative breaths. And when they did that, they noticed that there was a small break in the employee's glove. And there was some blood that got on into that break onto a cut on that employee's hand. Okay. So some commonalities here, right? We have first responders who are responding to something, officers, firefighters, paramedics, and they're obviously going to be in danger of being exposed to bloodborne pathogens because of the nature of the work they do. What about all of us, the rest of us though, right? Why do we have to worry about this kind of stuff? Well, it's because blood is incredibly dangerous. Okay. Blood and other mucous membranes, saliva, other things. It's dangerous, right? It's one of those invisible hazards that we can't see out there. We can walk into an office space and we can see, oh look, there's a cord on the floor. Don't trip on that. There's some ice outside. Don't slip on there. Okay? There's an unguarded platform over there. Let's not climb up on that. All right. There's an open electrical panel. Let's not go mess with that. Okay, those are things we can see. Blood and the stuff that's in the blood, that's one of those invisible hazards that we can't see. All right. And that one drop of blood that you see there on the screen, God, there could be so many things inside of that blood that you just don't know. You don't know what's going on there. You don't know what kind of nasty stuff is in that one teeny tiny drop of blood that can make us incredibly sick. Now, that's why this kind of stuff, this bloodborne pathogen stuff is an OSHA requirement that we go through, because there are lots of diseases that can come from a bloodborne pathogen. These are just some examples. Okay, HIV and AIDS, hepatitis B, hepatitis C, and we're really worried about hepatitis C, for example, because hep C can live outside of the body for a long, long time. Okay, you could live for a long time and not know you have hepatitis C. You could be a carrier of hepatitis C and never know it. The symptoms won't display themselves until some certain time. Okay, that's why we're incredibly worried about some of these, just because they're hardy, they live outside the body for a long time, and just a small amount can make us incredibly sick. Okay. Now, when we talk about occupational exposure, what we talk about is, do you have a reasonable expectation that you could be exposed to some kind of bloodborne pathogen in your daily job. Now, those examples that we looked at earlier are first responders, right? Our officers out in the field, firefighters and paramedics, the heroes out there doing some great work. They're going to be exposed for sure. All right. What about an office worker, a city recorder, a planner, a community development director who I'm sitting at a desk all day long working on projects and things like that? Do I have occupational exposure? Does the person who's out in the maintenance yard who is doing maintenance work or sprinkler or irrigation work, do they have occupational exposure to bloodborne pathogens? Well, the answer is yes. Everybody does. All right. That person who's sitting behind a desk all day working on projects and overseeing things, can they go in a lunchroom or in a break room and somebody cuts themselves with an apple? Or somebody slips and falls outside and now they have blood on the ground? Or somebody gets sick at work and starts coughing and there's droplets in the air? Absolutely. Everybody has the potential to be exposed to a bloodborne pathogen, okay? Which is why it's so important that we are aware of these things, okay? It's not just the medical field, the janitorial, fire, EMS, law enforcement, wastewater operations. Anybody could be affected by a bloodborne pathogen. And that's why there's an OSHA standard built around this, okay? The OSHA standard says that you have to receive training on bloodborne pathogen awareness and that there is an exposure control plan in place in the workplace. It has to be a written document that details all of these things, details the exposure assessment, like who can be exposed and to what specific types of bloodborne pathogens could they be exposed to. What if there's an exposure? What do you do? What kind of evaluation is there? What kind of follow-up is there? Do you provide vaccinations? And what vaccinations do you provide? What kind of engineering or workplace practice controls are there in place? Okay, we're going to talk about a lot of these things that is baked into the OSHA standard here, just so we can be well aware of what our requirements are as employees and as employers to make sure that our people are covered. Okay, now the first step is being prepared and anticipating these exposures and just realizing that anyone can be exposed at any time. Okay, I say if it's wet, warm, and sticky and it's not yours, don't touch it. Okay, don't touch it without proper preparedness, proper equipment, proper personal preparation, and personal protective equipment. Okay, we have to be prepared. We have to know that, man, we could be exposed to this really at any time. Now, when we talk about vaccinations, okay, it's required of us that we offer the hepatitis B vaccination to affected employees and to our employees. It is our choice to get it or decline it. Okay, you can get that vaccination or you can decline it. Now, that is all your personal choice. You can do whatever you want to do. Now, other vaccinations that could be out there, but that's really by occupation and if it's determined if that is needed, something like tetanus and things like that, okay? But when we talk about hepatitis B and if you want to get it or you choose not to get it, if you choose not to get it, you'll have to sign a declination form. Okay, this is the language that's inside that declination form. But the really important part here is near the end, where it says if in the future that you continue to be exposed to a potential hepatitis B or potentially infectious materials, and you want to be vaccinated against Hep B, you can do that at no charge. So this is great because you can change your mind. Say when you're first hired, you decide, you know what, I don't want the Hep B vaccine. I'm not going to get it. I'm not going to need it. 6 months later, a year later, you're thinking to yourself, you know what, I kind of want that. I kind of want to do it. You can do that. You can change your mind. You can go back. The employer has to pay for it for you, and you can get that series of vaccinations done. That's a thing, right? This helps protect us. This helps protect us and gives us the option to choose if we want it or if we don't. But we can always change our mind if we need to. Okay. Now, when we talk about the defense against bloodborne pathogens, okay, many of us have probably seen a triangle like this in the past. Okay, it designates, at the top of the pyramid, this is our most effective thing we can do. We try to eliminate or isolate the hazard from the employees. Okay, we use engineering controls. Okay, we use different pieces of equipment, we substitute something, we do something a little bit differently. Okay, that's an engineering control. If an engineering control does not take away whatever that bloodborne pathogen or whatever that danger is, then we move down to an administrative and work practice control. You can think of these things as like rules that the employer puts in place that says the way you have to do something in order to make sure that you don't put yourself in danger. Okay. And then if that bloodborne pathogen, if that hazard is still there, even after employing engineering controls and administrative and work practice controls, then we get into personal protective equipment. Personal protective equipment is the least effective form of defense against a bloodborne pathogen, just because we know the pathogen is still there. And now we've got to put something on our body. We've got to do something to help try and protect us. But there's no such thing as perfect personal protective equipment. Things break, things fail, things don't fit right. And like that example we saw earlier, where there was a firefighter giving CPR, they were wearing gloves. They had their personal protective equipment on, but it broke. And there was a cut, and there was blood-to-blood contact, and now we have a bloodborne pathogen exposure incident. Okay? So let's talk about some of these things. Again, here's the OSHA standard that says engineering and work practice controls shall be used to eliminate or minimize employees' exposures to a bloodborne pathogen. Whenever you see shall in OSHA language, that means you gotta do it. Okay, it means must. Okay, so we have to employ engineering and work practice controls to help minimize exposure to a bloodborne pathogen. So engineering controls, what are those? What are some examples? All right, engineering controls, some examples are providing the PPE, the personal protective equipment. Okay, that's an engineering control. Having approved containers for disposals of sharps, biohazard bags for disposing of soiled materials, hand washing facilities and supplies to correctly and effectively wash your hands, sharp safety devices, self-sheathing needles, things like that. Those are all examples of engineering controls. Those are devices or things put into place by our employer to help reduce our chance of being exposed to a bloodborne pathogen. Okay. So then we have workplace practice controls, which is the other half of the OSHA standard that says that that has to be put in place for us to avoid being exposed to a bloodborne pathogen. Okay. Work practice controls, again, you'll see some commonalities here, requiring the use of appropriate PPE, procedures for the safe handling of sharps, procedures for disposing of contaminated materials. Okay, procedures, protocols, procedures. What do you notice here? Yeah, these are rules and regulations. These are what the employer or your supervisor says, you gotta do this when you're working with this piece of equipment or you're doing this piece of work. Because there's potential exposure to a bloodborne pathogen, here's our rules so that we can help reduce your risk of being exposed. All right. So if those two things, they don't take away that chance that you're exposed to a bloodborne pathogen, then we get to the least effective way, but it's still a way that we have to be aware of is personal protective equipment. Again, PPE is not perfect. There's no such thing as perfect PPE. All right. PPE should be used whenever there is blood present or there's potentially infectious materials present. Okay. You should wear PPE. You should have gloves, smock, mask, goggles, whatever it may be, in order to help keep you safe. All right. Know what your employer's guidelines are. So know what it says in your bloodborne pathogen exposure control plan. How and you put on your PPE, how you take it off, how you dispose of it, how you fit it to yourself. And it's very, very important that you remember hand hygiene is 100% the most effective way that we can make sure that we don't get a bloodborne pathogen into our system. Okay, wash your hands. Hey, we heard a lot about that in 2020, didn't we? Wash your hands, wash your hands. Okay, that's great advice. That is great that we should keep taking because that's going to prevent a lot of these bloodborne pathogens from entering our systems. Okay, hand hygiene is incredibly important. Before you put on PPE, before you put on your gloves, gotta wash your hands. After you take your gloves off, gotta wash your hands. Okay, wash your hands. Wash your hands, wash your hands, wash your hands. Okay, so let's talk about removing gloves for just a minute here, because this is one of those skills that you need to practice. I've got a bunch of blood on my hands. I've cleaned up somebody's vomit all over the ground or somebody else's wet, warm, and sticky fluid that's not mine. Okay. Clean that stuff up. Took care of somebody with a bloody nose. What do I do now? How do I remove my gloves? Okay. So what you do, you take one hand, you turn it palm up. Okay? Turn that hand palm up, pinch at the wrist. Pinch as you pull that glove away from you, turn that glove inside out. As it turns that glove inside out, take your other hand that just pulled that glove off, take that glove and put it inside of that gloved hand, close your fist around that, then repeat the process. Pinch the outside of the, or take two fingers, put it underneath the glove. So now you're touching the part of the glove that's not soiled. And you're going to pull that glove up and over your closed fist, and that'll turn that glove inside out. So now you've got a clean edge that you can grab and you can throw it inside a biohazard bag or throw it inside the biohazard receptacle. Okay. Removing gloves is one of those skills that is great to practice. I encourage you to do that. Maybe go today, tomorrow, sometime this week. Go grab a pair of gloves out of your first aid kit and practice removing them and taking them off. Imagine you got blood all over your gloves or something that you don't want to touch. Okay. Practice removing those gloves, taking them off, and making sure that you aren't touching the soiled side. Okay. Give that a chance. Give that a run and see how it goes. Then after you take your gloves off and properly dispose, what should you do? Wash your hands, right? Wash those hands. Okay. Oh, let's talk about cleanup for a minute. If there's a spill, if there's blood on the ground, if somebody came in, they're dripping blood all over the place, what do you do? Okay. Cleanup is essential for preventing disease transmission. Because again, hepatitis C can live outside the body for a long time. Okay. You got to clean it up and you got to disinfect it. A bleach solution, okay, is a great thing to use to help clean up some of these things. They also have bloodborne pathogen like control kits you can buy. And inside of these kits, they have the disinfecting type of materials. They also have like this shaker in there that you can shake on top of blood, for example, and it'll coagulate that blood and make it easy. You can just sweep it up into a bag and check the biohazard bag, and then spray, and scrub, clean everything up, and it's back to normal. Okay. So a cleanup kit is very, very important. Disinfecting the materials that were used and things like that, the blood that was spilled on the ground. Bleach solution is the best thing to use in those situations. Now we talk about disposal of like soiled material, soiled gloves and things like that. How should we do that? Well, you've probably seen these red biohazard bags hanging around the shop somewhere. Okay. That's where all the stuff goes. That's where all the blood soaked stuff goes. That's where your gloves go that you've used and things like that. But what do you do when it's full? How do you dispose of the red bag waste and the sharps containers that are full? What do you do with those things? I encourage you to find out what you should do. And that should be written inside of your bloodborne pathogen control plan on what we do with a red bag waste or sharps when they're full. And what do we do? I've worked in places that have been different all over the place. Some of them I could just take that red biohazard bag and throw it in the garbage can, and then we sorted it at the trash place. Okay. Other places I had to actually separate that out from my regular trash and call the health department, and they came and picked it up. Or I had to contract with a third party that would come and pick it up from my place of employment. Okay. Find out, because it's different everywhere. Find out from your waste management company who services your area what they want you to do with that red bag waste and how you should properly dispose of that. Okay. Now, if we've been exposed, if you feel that you, excuse me, if you feel that you were exposed to some kind of bloodborne pathogen, what should we do? Okay. Number one, decontaminate the exposed area. Wash it well, warm water and soap. Okay. At least 10 minutes. Wash it and flush it. Get it scrubbed out. Wash it really, really good. Number two, make sure you notify your supervisor. Let your supervisor know that there's been a potential bloodborne pathogen exposure here. And then if there is a significant exposure, make sure you seek medical attention. Now, what do we mean by significant exposure? Okay. Significant exposure means direct blood to blood or mucus to blood or blood to mucus type of contact. Okay. So for example, if I get a drop of somebody else's blood on my arm, is that a significant exposure? Well, it could be, right? Because if that drop of blood gets on an existing cut or a sore that I have on my arm, then yeah, that is a significant exposure. But if it's just a drop of blood on unbroken skin, that's not a significant exposure. Go ahead and just wipe that off. Wash it well with that warm water and soap, decontaminate that area. You're probably good. Okay. But if it's blood gets in your eyes, in your mouth, other bodily orifice in your nose, direct blood to blood or mucus to blood type of contact, okay, that's what we consider a significant exposure. You want to seek immediate medical attention for those kind of things. Okay. Um, Notify your supervisor anytime you get a blood, a potential blood exposure, even if it's not a significant exposure. Okay. Even if it's just that blood droplet on your arm where there's no cut or anything, you just wash it off. Still notify the supervisor, still document that incident so you can make sure you're covering your bases. But with all of these exposures, anytime there is some kind of potential exposure, okay, make sure you complete your documentation. Document what happened and what you did. And if it's significant, make sure you seek that immediate medical care. We do have sample documentation for you. And if you need some of these, need your bloodborne pathogen exposure control plan, let us know. Mike at utahtrust.gov, Jason at utahtrust.gov. Give us a call, send us an email, send us a text. Let us know what we can do to help you out. We have some boilerplates and stuff that we can send out to you to help get this plan going. But you need to have a written, documented plan inside of the organization, and everyone needs to be trained on your specific bloodborne pathogen control plan. If you haven't been trained on this, or if you're a supervisor, you haven't trained your team on it, this is something this week to really get on the calendar so you can make sure that you get the folks trained that need to be trained. All right. Just really accept that these things can happen. Anyone can be exposed to bloodborne pathogen. Doesn't just have to be the maintenance worker or the first responders. Prepare for it. We prepare for it by realizing that, yeah, we're going to be exposed. Let's take the proper precautions so we don't get sick. If there is an exposure, make sure you document it. Okay. If you do get somebody's blood on you, make sure you document. And if it's that significant exposure, blood to body orifice, eyes, ears, mouth, nose, those kind of things, make sure you seek immediate medical attention. And then constantly evaluate your program. What this means is make sure that we're trained, our employees are trained. They've gone through bloodborne pathogen training. They know where to go. They know where the personal protective equipment is and how to protect themselves to lessen the blow of a bloodborne pathogen exposure incident happening. Okay, that's all we got for you today on this one. Jason, do we got any questions?
I don't have any yet. If you got questions, folks, type those into the chat box and we will answer those at this time. Great presentation, Mike. Important to consider that and keep that in mind. That's a simple thing, and boy, have that PPE ready because you never know when you're going to be called to do something like that.
Yeah, you never know when you're going to need it. You got to make sure you got it.
All right. It looks like we have absolutely zero questions, which disappoints me a little bit, but you must have done a good job. Thanks, folks, for that. Final word, Mike.
Well, thanks everyone. Just again, take a look at your plans today. If you haven't been trained on it, ask your supervisor about it. Ask about this control plan. And if you are a supervisor and you haven't trained on it, here's a good time to do it. Get it done so we make sure we keep everyone safe. But thanks, everyone. Appreciate all you do.
All right, folks. Thank you. Go out and have a safe day.